First I'm going to start by either washing my hands for 15 seconds or using a hand sanitizer. So today I will use a hand sanitizer for time purposes. And I will begin by assessing your mental status and level of orientation. So beginning with, what is your name?
Adam Maloney.
Okay, and what is the date today?
August 13th.
And where are you?
Fort Mitchell.
And what brings you in today?
Your physical that you're going to do with me.
Wonderful. So use alert-oriented times 4 to person, place, time, and situation. Next, we are going to move on to getting his vital signs. So I'll begin by getting his temperature. And underneath your tongue. .1, so that is excellent, that's normal. And now I'm going to get your heart rate and count your respiration, so find the radial pulse. And I got 50 for your pulse rate and 16 for your respirations. So that is all normal. And next I'm going to get your blood pressure. Do you mind if I use your left arm? And I'm going to find the brachial pulse. All right, and both brachial and radial pulses are +2. And I got 110/80. That is also within normal limits. Next, I'm going to move on to the head. So upon inspection, it is the appropriate size and shape. It's round, normal cephalic. Now I'm just going to palpate and tell me if you have any tenderness anywhere. Do you have any tenderness anywhere?
Nope, no tenderness.
And I don't feel any swelling or bumps. The hair is normally distributed. I don't see any areas of alopecia or balding, and no indication of infestation. So all of that is with normal. Next, I'm going to move on to your ears. Upon inspection, they are symmetrical, the appropriate size and shape for your stature and head. I'm going to palpate and just tell me if you have any pain upon touching. Any pain?
Mm-hmm.
Okay, wonderful. Now I'm just going to take a quick look inside with the otoscope. And okay, so the tympanic membrane is kind of a pearly gray color. It is not bulging. There's no erythema, no drainage, just a little cerumen, which is normal. And I'll take a look at the right ear. And similar findings on this ear as well. The tympanic membrane is the appropriate color. No bulging, drainage, or erythema. We'll just quickly test for cranial nerve number 8, the vestibulocochlear, and do the Rene's test. So I'm just going to hold this to the bone behind your ear and then next to your ear, and then just tell me which one is lasts the longest and is louder.
That's louder.
Okay, so the airway conduction was louder. That is a positive Rene test, which is normal, and that indicates that that nerve is intact. Next, I will move on to the nose. So cranial nerve number 1 is the olfactory nerve. Do you have any issues with smelling? You're able to correctly identify the appropriate smells. Okay, excellent. So upon inspection, it's midline, it's symmetrical. I don't see any swelling. Just tell me upon palpation if you have any tenderness or pain anywhere.
Nope.
Wonderful. And then we'll just take a quick look inside with the otoscope. Okay, so I don't see any erythema or swelling. No drainage, so all of that is normal. And now I'm just going to palpate your sinuses and tell me if you have any tenderness on the maxillary. Any tenderness?
Nope.
And then the frontal?
Nope.
Excellent. All right, so now we are going to move down to the eyes. Looking at your eyes, they're symmetrical. I don't see any drooping. The sclera is white. The conjunctiva is pink. I'm just going to assess for the cranial nerve number 2, which is vision. So looking at your pupils, they're equal, they're round, and I'm just going to see if they both react to light, so just look straight ahead. Okay, and then this side. Alright, so both pupils constrict briskly upon light, and that is all normal. Now I'm going to assess for cranial nerves number 3, the ocular motor, 4, the trochlear, and 6, the abducens. So I'm going to assess this by doing the 6 cardinal fields of gaze. So just follow my pen with your eyes without moving your head. All right, and then just follow the pen, and his eyes converge. So all of those were intact. So 3, 4, and 6 are all intact. Next, I'm going to take a look in the eyes with the ophthalmoscope. So just look straight ahead again. Okay. So I was able to see the red reflex. The optic disc was round, clear defined edges, and a kind of yellowish pink color. Next, we're going to check your vision. Do you wear any corrective eyewear or contacts, lenses? All right. So this is the Snellen eye chart. We will go and assess it at 20 feet away. Here. I'm going to have you cover your right eye and read the lowest line of letters that you can see.
D-E-F-P-O-T-E-C.
Excellent. And then the other eye.
D-E-F-P-O-T-E-C.
Wonderful. So you have 20/20 vision. That means that you can see what the average person can see on this chart at 20 feet away. So we will come back inside. Now I'm going to assess for cranial nerve number 5, which is the trigeminal nerve. So just close your eyes and then please say now when you feel the cotton wisp on your face.
Now, 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 now.
Wonderful. So that is all intact. And then we'll assess cranial nerve number 7, the facial nerve. So I'm going to have you raise your eyebrows up real big and then smile and frown and puff your cheeks out. Wonderful. So that all of that is intact as well. Now we're going to move on to your mouth and your throat. So your lips are pink. I'm going to have you open up your mouth for me and take a look inside. Your dentition is good. The buccal mucosa is pink and moist. I don't see any lesions. Lift your tongue up. And all right. And then I'm going to have you stick your tongue out for me and then say, ah. All right, so the uvula rose symmetrically, so that was assessing for cranial nerve number 9, the glossopharyngeal, and number 10, the vagus. And then for the SS for cranial nerve number 12, the hypoglossal, I'm going to have you stick your tongue out and move it up and down and side to side, and then inside your cheek and push, and this side. All right, so that number 12 is intact as well. Next, I'm going to move down to your throat and your neck. So looking at your neck, it is symmetrical. I don't see any swelling. Tell me if you have any pain when I touch. Okay. Your trachea is midline. I'm going to assess for your thyroid gland, so go ahead and swallow for me. All right, so that is not enlarged, and that is all normal. I'm just going to palpate for your lymph nodes, so I'm going to begin with the preauricular, then the postauricular, the mandible, the submandibular, and then the anterior cervical, and the posterior cervical, the occipital, the deep chain cervical, and then the supraclavicular. And did you have any pain with any of those spots? Okay, I did not feel any of the lymph nodes, so they were not swollen, and that is all normal, within normal limits. I'm also going to assess for cranial nerve number 11, the spinal accessory. So I'm just going to have you try to shrug your shoulders against my hands, okay, and then turn your head against my hand, and then the other side. All right, so that is all intact as well. Now I'm just going to feel for your carotid arteries on the right side. All right. I did not feel any thrills, and I'm just going to listen now. Excellent. And I did not hear any bruits, so that is all normal as well. Next, I'm going to move down and do your lungs. So upon inspection, you're breathing easily. No use of accessory muscles. Your respiration rate was an appropriate rate. So I'm just going to test for tactile fremitus. So just say 99 when you feel my hands.
99, 99, 99.
All right, and now I'm just going to auscultate for your lung sounds. So just take a couple deep breaths. So lung sounds were clear. I didn't hear any crackles or wheezing, no stridor or rhonchi. I'm just going to assess posteriorly now. Say 99 again.
99, 99,
Okay.
99.
Wonderful. So I felt the tactile fremitus. I'm just going to lift your shirt up a little so I can listen to your lungs back here. So just a couple deep breaths. Excellent. And all lung sounds were clear. No crackles, wheezes, stridor, or rhonchi. Now I'm going to move on to the heart. I'm just going to listen to the 4 heart locations. So the aortic, and then the pulmonic, and then the tricuspid, and the mitral. All right. So I heard S1 and S2. I didn't hear any additional hard sounds such as S3 or S4, and I did not hear any murmurs. So now